Summer is a time of enjoying fruits, wearing cool clothes and going for great holidays. But it is also a time of trying to fight the heat, the sultry weather, and also if you do not take care of yourself, you could come down with something as mild as a heat rash or something as severe as a heat stroke, which could also turn fatal in certain circumstances. Welcome to Healthy India. I'm Lottie Alaric. As you must have gauged by now, today we are going to talk about health-related illnesses. To carry this discussion forward, I have in the studio an eminent panel of doctors. It is my privilege to welcome Dr. Sunil M. Raheja, who is a general physician with the G.B. Pant Hospital. Sitting to his right is the well-known Dr. B.K. Khaitan, who is a dermatologist at the All India Institute of Medical Sciences. And to my left is Dr. Arvind Saili, another well-known pediatric who is at the Lady Haring Medical College. So I take this opportunity of welcoming all of you to the show.
Thank you. Thank you.
Well, people, before we actually start discussing as to what heat-related illnesses are, let's take a look at this report.
Summer is a time that is dreaded by all. With abnormally high temperatures, life becomes drudgery. One keeps looking for ways to cool oneself. Our body normally cools itself by sweating. During hot weather, especially with high humidity, sweating is not enough. Our body temperature can rise to dangerous levels and can develop a heat illness. Most heat illnesses occur from staying out in the heat too long. Exercising too much and physical condition are also factors. Older adults, young children and those who are sick or overweight are most at risk. Heat-related illness is a serious medical condition resulting from the body's inability to cope with a particular heat load and includes heat cramps, heat exhaustion, heat syncope and heat stroke. The most important measures to prevent heat strokes are to avoid becoming dehydrated and to avoid vigorous physical activities in hot and humid weather. Drinking water is the best way to beat the oppressive summer that has led to a spurt in heat stroke cases. As soon as you feel symptoms of dehydration like nausea, fatigue, rapid breathing and irritability, which are not being controlled by home measures, you must seek medical assistance. Medical experts say that dehydration or lack of water content in the body can even lead to death if it goes undetected. Bureau Report, Lok Sabha Television.
Well, people, now we are going to tell you exactly what heat illnesses are and what can you do to prevent to not really get down into the heat and get all these kind of illnesses. So let me start with you, Dr. Raheja, that what is the preparation that a person should do when the summer approaches?
Basically, when the summer is approaching, the person is more prone to heat wave and heat related illnesses. And as we know, the heat related illnesses, they are more common when the person is exposed to hot and humid weather.
Right.
And the person is working in the hot and humid atmosphere for a longer time. And it is more common in the people, those who are not acclimatized.
Right.
With compared to people, those who are working in the sun for a longer time, because they get acclimatized. And to avoid this condition, because it can be a very mild condition from the heat rash, which is just a mild illness which we see in the children because of they are playing in the sun and hot weather. There is just redness of the skin, pimples and blisters, small blisters. It can then we can have heat cramps. And that is because of the depletion of certain electrolytes like sodium in the body and involvement of the long muscles. And that can be prevented by taking lot of water containing sodium and salt along with some lemon, so that we can counter that electrolyte imbalance. And the next stage comes the heat exhaustion. When the person
we will tackle all those one by one, Dr. Raheja, but before that, Dr. Khaitan, I'd like to come to you since you're a dermatologist and skin is the first organ, the largest organ of the body which is exposed to the heat. So we do hear about sunblocks and sunscreens, but how can one really go about preventing the whole body?
Yeah, in fact, one should differentiate between two situations. One is hot and dry situation.
Right.
The other one is hot and humid situation. As we know, in many parts of the country, it is not as humid. But if you go towards coastal area, it is hot as well as humid. So the water and electrolyte imbalance, as Dr. Raheja has pointed out, will differ in these two situations. And we may not be knowing that more than a liter fluid can be lost through perspiration in a hot condition, which is a very large amount. The normal, which is not perceptible perspiration, it is 200-300 ml or so. But if it is beyond a threshold, then the entire load will go on the internal organs as well. The vasodilatation is so much that it will affect the load on the heart. The circulation has to be more, and the sweat glands, which are very important glands. I'll tell you, there is a condition where there is no sweat gland. It is a rare condition.
Yes.
And in those children where there is no sweat gland, ectodermal dysplasia, the temperature can go as high as 105, 106, 107, what we call hyperpyrexia, without even activity, without going under the sun in hot condition.
Right.
So sweat glands are our friends. So, but then you can't overload them. So it is important to understand how much sweating is fine. Beyond that, you have to compensate.
Right, right. And Dr. Selly, talking of little babies, somehow in our country people feel that if the baby is too small, he or she has to be covered all the time. So even in the summer, sometimes you see women carrying their babies and they are nicely covered. So what is your advice to those kind of women? First of all, I'd like to ask you, do little babies also feel as hot as we adults do, or is there a difference?
Look, when you're talking in terms of newborn babies, the situation is different.
Right.
Because they tend to lose more heat, more water from their skin, because the skin happens to be very, very thin. And so they have to be protected in terms of hypothermia, that means temperature falling. But when you're talking in terms of babies who are a little larger, then of course they are absolutely as prone to hyperpyrexia as anybody else. But extending from Dr. Khaitan what he said, let's look at the normal physiology as it occurs. Now, normally when this temperature just rises, the skin starts dilating, the skin vessels they start dilating, and the heart starts beating faster, and the temperature tends to adjust. But after that, after a while, when the temperature rises a little further, the sweat glands come into play, and like he said, they are our friends. But the sweat glands can only help when the environmental humidity is okay.
Right.
You see, if the humidity is very high, then evaporation is not occurring. Evaporation, when it occurs, it takes off, the evaporates from the skin, and the temperature starts dropping. That's when the coolness occurs. But if this humidity is high, this evaporation is not going to be there.
Right.
So the person is going on sweating, but the humidity being high, there is no use. I mean, the temperature is again carrying on rising.
Right.
So that's the difference that is there between high humidity and high temperature, and a high temperature alone. So one has to be very cautious in the two situations, like has already been elaborated, because water loss and the sodium loss is what really creates all the problems and the consequences which occur, which is heat exhaustion, then heat cramps, and heat stroke, and what you have you.
Right. So let's begin with the heat rash, as he was telling us, Dr. Raheja. Now, when we talk of heat rash, how severe can it get, first of all, and when is it that a person should really wake up and take a call on that?
Yeah, basically heat rash is a mild illness, and it's normally seen in the children, those who are playing in the sun, and the people, those who are working under the sun for a longer period, and that too if the person is wearing the synthetic clothes.
Right.
Okay, because cotton clothes are really good friends, because cotton is the one cloth which can absorb the sweat and dissipate. By evaporating, it can give you cooling, whereas synthetic clothes, they don't let the sweat evaporate from the body.
Right.
So the illness can be mild red rash in the form of a blisters or small pimples, and if the person is not getting proper attention, it can next stage is the heat cramps, as we have already talked. The person will have the because of the sweat, the body can maximum lose 1 liter of fluid in 1 hour, and by that the body will lose around 600 calories. That is the maximum body can do in an hour. And if the production of heat in the body because of metabolism process is more, and at the same time the temperature outside the body is higher, the body finds it really difficult to dissipate the heat. And the dissipation of heat can occur by 3 processes. One is the convection by air, and the second method is radiation, that is just by in the electromagnetic rays, and third is evaporation. And when the body temperature gets very high, evaporation is the most effective way to dissipate the heat from the body.
Right.
So that is where we have to click in the patients, those who come to us with heat exhaustion or heat stroke.
Right. So, Dr. Khaitan, in a case of heat rash, I'm sure there's also itching that takes place once a heat rash sets in. So, what should a person do? Because one hears of so many, the home remedies and all that, but I would not like to get into those.
In fact, I'll just add another point that it's the airflow which is also important. Heat, humidity and airflow. And in addition, the occlusion effect. Suppose somebody is wearing a very tight clothing, waist as we in the gentlemen, and some ladies who will wear. So, the evaporation will not be as effective as if it is loose. So, in that situation, the chance of getting what we call prickly heat is more. If the airflow is better, the chances of prickly heat is less.
Right.
Prickly heat is just exhaustion of the duct, the sweat gland duct. It is a response that it is a signal that okay, I am exhausting.
Right.
So it doesn't happen unless it exhausts. And if it is superficial, then there can be very, very tiny superficial vesicles. But if it is deep, then they are red, tiny papules, what we call which is called the routine prickly heat. The prevention is the best way to do to help in this condition. But if it happens, one has to ensure that one enters the cooler environment, which may be difficult for a laborer who is working outdoor, for a child who is playing outdoor, and you can't make the entire thing air conditioned. But one can avoid rigorous activity so that the sweating is not further added to that. So if a person is having prickly heat, he should be having lighter activity rather than very rigorous activity. And all these remedies like powder and dusting powder, etc., they give transient soothing effect. They do not actually alter the course. And of course, it is self-limiting. Within a couple of days, it improves on its own.
But those couple of days can be heart-wrenching, I'm sure.
Yes.
So now for these, I'll just take this a little more further because, okay, once there is this heat rash has set in and the powders, the way they advertised on TV, everybody thinks that the more expensive the powder, maybe that is what is going to give me relief. But at home, what can a person do?
But I would say that, look, I mean, initially when the person is exposed to a little bit of a heat, there is something which Dr. Khaitan has referred to, malaria, whitish papules, they are occurring. And then this progresses once the heat becomes a little more severe. It progresses to what is the prickly heat or the reddish erythematous rash which is occurring. And generally, it tends to occur in the flexure areas. I mean, in the axilla or wherever there is a fold of skin there, it tends to occur there. And I feel that what Dr. Saab has said is quite pertinent, that if you are wearing slightly loose and cotton clothes, this tends to get absorbed, because the moment there is some amount of water there, some amount of sweat there, and some amount of humidity there, so that worsens the condition. So I would say that if you are saying that you're looking at a home remedy, one is that the people should be playing in the cooler environment. And let me say that, look, when you have people from the lower socioeconomic strata, they all move around in the sun, they don't have this problem. It's only when you are not used to that kind of a setup and you go into that kind of a setup, obviously the things are going to be bad. So if you have people who are always indoors and then they are exposed to an external environment, it's going to be worse. Whereas you have very small people who are at the red lights, you will find the children being carried out and nothing happens to them. So it's just getting acclimatized to the stuff. So I would say people who are used to being indoors, they should remain indoors, shouldn't be in a cooler environment, wear loose clothes, see that the air circulation is good, and I think that really helps out. So these powders and all, like he said, they are just transient relief. They tend to even suck out the moisture which is there, which tends to help out. Otherwise, the phenomenon is transient and it tends to abate by its time.
You should maintain good hydration.
Absolutely. We will come to that, Dr. Aheja, but right now we have to slip into a very short break here. But people, when you come back, I'll invite you to, and you can call us and ask my panelists as to whatever you have to regarding heat-related illnesses. We'll be back in just a moment.
साहित्य भवन की क्या है हलचल, सृजन क्षेत्र में क्या है खास, कोना किताब संग जानेंगे हम, झरोखों से आई किसकी याद। देखते रहिए साहित्य संसार हमारे साथ सिर्फ लोकसभा टेलीविजन पर हर सोमवार रात 8:30 बजे।
Welcome back. This is Healthy India, and today we are talking about heat-related illnesses. So people, if you have a question regarding the same, do call us right away as our numbers are opened, and the numbers are 1800115314 and 23035420. Just remember to turn down the volume of your TV set so that we can hear you and you can hear my panelists. Well, having said that, we are joined by Mr. C.M. Jethli from Mumbai. So Mr. Jethli, if you can hear me, welcome to the show.
Yes, नमस्कार
जी.
देखिए बम्बई में टेम्परेचर जो है समझो कि मैक्सिमम 35-36 होता है, लेकिन यहाँ पे इतनी कम गर्मी होगी दिल्ली के हिसाब से तो भी शरीर को बहुत फुंसी जैसी होती है और सिर में भी फोड़े फुंसी निकल आते हैं
जी.
जबकि समझो कि हम लोग ना समझो एसी में बैठ रहे हैं, कूलर में बैठ रहे हैं, पंखे के अंदर बैठ रहे हैं और घर से बाहर भी ज्यादा नहीं निकलते तो भी ये हो रहा है, तो इसका उपाय क्या है?
जी, थैंक यू फॉर योर क्वेश्चन. डॉक्टर रहेजा, आप उनका जवाब देना चाहिए.
Yeah, basically, you know, Bombay being a coastal city, the atmosphere there is hot as well as humid. और हॉट एंड ह्यूमिड एटमॉस्फेयर है तो उसकी वजह से जो स्वेट ग्लैंड्स हैं वो पूरा कार्य नहीं कर पा रही हैं. जैसे डॉक्टर खतान ने भी बताया है, उसमें यह है कि जो स्वेटिंग होती है तो वो प्रॉपर उसमें एवोपरेशन नहीं हो पाती है और इसीलिए इतने कम टेम्परेचर पे भी इनको जो प्रॉब्लम्स बता रहे हैं स्किन रिलेटेड है, दैट विल बी देयर.
तो उन्हें क्या करना चाहिए डॉक्टर?
इसके लिए इनको बेसिकली जो मेन इशू है, इनको मेरे ख्याल तो गर्मी से बचाव करना चाहिए. जितना पॉसिबल हो सके ठंडे एटमॉस्फेयर में रहे जहाँ पे एयर कंडीशनर्स हों. आई मीन द एयर इज नॉट दैट हॉट एंड ह्यूमिड and the body should be fully hydrated, and for that, you know, the best way is home remedy is you can take a half liter of water, put 4 teaspoon of sugar. If you are a diabetic, don't put sugar. You can put half teaspoon of salt, normal salt, and half normal size lemon, and keep I mean you can take a liter in a day, and I think that will take care of your hydration problem.
All right. Now, talking of hydration, this is a time when not only babies but even adults do tend to get dehydrated. So, in such a situation, what should be done, Dr. Khaitan?
The periodical intake of water, sipping of water, even if it is small amount, it has to be periodical because sweating is almost continuous.
Yeah.
And then one should not wait for the real desire to drink like thirst, because when we reach that stage when the thirst is there, that means already the body is giving very strong signal that we need water. So rather than waiting for that signal, one should regularly take more water.
Right.
And more than pure water, I mean, as Dr. Raheja has said, if some salt is there and in some calorie sugar is there, it is even better. And if there is no fan, no AC, sipping of cold water also help. You can't take cold water in a large amount, but if you sip, then the temperature goes down. It has a psychological effect, good feeling as well. The one important point is that in a day, one has to, after all, decide how much we are losing. So it depends on how much one is sweating.
Right, right.
So you have to add accordingly.
Right. So, Dr. Seli, for a person, suppose he or she cannot really lay his or her hands on cold water and one is in a situation where there is really no water. So, what happens? How dangerous can this dehydration get?
Dehydration is the crux of the problem. You know, whenever we are talking in terms of any form where one is losing water, whether it is diarrhea or it is sweating or it is loss of glands or whatever, the basic thing is that the water is lost and along with that the electrolytes are lost. And that is what leads to the entire system getting deranged, which really means that your metabolism is getting deranged, your enzymes get deranged, your system gets deranged, and the whole gamut gets deranged. And so dehydration is the crux of the problem, and in fact what kills a child or an adult would be the dehydration and not anything else. And whenever we are talking in terms of the CNS symptoms coming up, which means the nervous system symptoms coming up, the child is becoming stuporous or the adult is becoming unconscious or the adult is convulsing, is because the electrolytes have taken a knock. They have taken a beating. So one has to look after the dehydration part, because dehydration is what is giving rise to all the symptomatology. So unless you are looking after this one, there is a problem. So dehydration is the crux of the problem, and you have to undo the dehydration. Whether you are having fluid by one way or the other, one has to really look into that matter very, very seriously.
Right. Well, at this point, we are joined by Mr. J.M. Rao from Maharashtra. So, Mr. Rao, if you can hear me, welcome to the show.
Good evening and thank you. My question is, to avoid sunstroke, is visits to relaxation place like the beach, can it help beat the heat illness? And second, in future, do you believe, panelists, that the global warming, if not controlled, can play havoc on heat illness? Thank you.
Yeah, thank you so much for that question. Dr. Seli, would you like
I
to
would
take
say yes. I mean, again, I had pointed out in the beginning of this session that people who are used to being in the sun, they tend to be a little more resistant to the problems of heat vis-a-vis the ones who are not. And that's one, I mean, when you look at the documentation, you look at soldiers. The soldiers are actually taught this way, that they train them in the sun. Once they train in the sun, they tend to beat the heat better. But obviously, having said that, there is no reason that you have to not undo the water loss which is there. So you have to take care of your hydration even when you're in the sun. And of course, being at the beach, it's okay. But as long as you are getting used, you will be able to be a little more resistant to the after effects. But having said that, you have to look after your hydration. And so far as the global warming is concerned, obviously it will have real detrimental effects on the health of people.
That's right. So, Dr. Raheja, now for a person who is dehydrated and certainly faints, what are the people who are around supposed to do and what are the right things to do at that time?
Yeah, the person who is dehydrated and has been exposed to heat and has fainted, the most important thing we should think is it's a heat syncope or it's a next stage from the heat exhaustion.
Okay.
When the person's blood pressure has gone down, the person is dehydrated, there is a postural hypotension. First of all, the person should be moved to the cooler place.
Right.
Fan should be on, the person should be made to lie down spine, because that way the body fluid will be again redistributed and you will have a better circulation in your brain, and most of the patients, they become conscious by then. And then after putting the person in the cool environment, if the room is not available, the person can be moved to a shady area. If the person is in a lawn or somewhere else, we can use the hose water, whatever is available nearby, because time is very important.
That's right.
We should remove the clothing and sponge the person from the head to the toe, because in that we are basically making three things to happen. One is, the most important is evaporation by cooling,
Right.
by sponging. Second is by convection, because of the fan is on, and third is by radiation, because the clothes are off. So we are using all the three mechanisms for the dissipation of the heat. And in the meantime,